My name's Brooke, and I'm in the RN to BSN nursing program at the University of Arkansas in Little Rock. Receiving your RN is a milestone. I have another 4-year degree, and I can easily say the 2 years that I spent getting my ASN were the hardest 2 years of my life. And I wish I could say that the hard part was over, but unfortunately this industry needs you. I've seen how toxic a bad nurse can be, and I've seen how contagious and motivating a good nurse can be. Find that nurse and cling to that nurse, become that nurse. Or if you've been in this career for a long time, make the change and be that nurse. For those of you just graduating, everyone else's job is to say, way to go, you did it. And I want to say, keep going. You know, this industry needs you. A BSN allows you to contribute to so many things, recruitment and retention, councils, quality improvement, and just overall organizational growth within your hospital. What I'm asking for comes a little more from the heart than from the head. This job is complex and it's dramatic, and it's so easy to lose that empathy and compassion that you've started with. And pursuing my BSN has allowed me to focus on why I became a nurse and why I am a nurse, and how I can keep the values and morals that were instilled in me, because they are very easily forgotten when a patient load is too heavy, or maybe other RNs aren't living up to their potential. Through my BSN program, I have been able to be part of integrated practice programs that allowed me to champion the courses or the topics that are important to me in my hospital while getting credit for it. So this year alone, I've focused on morale and customer service, and I can say that both have improved. And in fact, I'm hopefully and probably headed on a plane to Disneyland to present in a couple of months. So, I mean, find a BSN program that is focused on furthering you and your career, because mine has, and it has shown. And not only has it shown in me as a nurse, but it's shown to my organization. I've been recognized for the work I've done through my BSN program for my hospital. A BSN allows you to find your balance and hold on to your values and champion the things that you care about. You'll never be as passionate as you are right now if you don't make it a habit. I had no idea what I wanted to do the first time I walked into a nursing classroom. Absolutely no clue. I didn't know why. I all of a sudden I'd forgotten why I chose this path, why I chose this career, why I was here. I had known nothing about any of this. What am I doing? And then it all changed the minute I walked into my first pediatric clinical. I fell in love. I knew where I wanted to be, and my goal is to eventually be a pediatrics instructor and to hopefully find that passion in other students. This major is unlike any other in that you can change and transform as many times as you want. You can play any role you want. There's administration and education and research and development and clinical work. And if you're unhappy, there's always a different path for you to take with this degree. I wish somebody would have told me how quickly you become emotionally invested in this career, because you learn very quickly that you can't fix everyone and you can't fix everything. But my BSN program has led me to learning to take steps to make the changes that I need to see and that I feel like I need to be a part of. So it's growing and changing one day at a time. An organization and bad practice isn't going to change overnight, but I've learned ways to put programs in practice to make that change happen. As for school, my advice to you is to know your professors. They are going to become your biggest advocates. And as for those of you that a BSN is standing in the way of the hospital that you want to work at or the career you want to have, communicate. Know your nursing recruiter and tell them email them. My nursing I had my job 6 months before I graduated. Make them know your name, and let them know that you're on your BSN path and that your goal is to work at their institution, and make sure you have that job. When they called me, they knew me, and so stay in communication. It's very easy to stay distant when you're on a BSN path that's online. So, that's my biggest advice there, is to stay in contact. You are what this healthcare industry has to look forward to. You had the motivation to Google this and click on this site and click on this link. Now fill out the application and start your way towards a better career for you and better care for your patients. Thank you.